A client with a seasonal allergic rhinitis is prescribed loratadine. During teaching, the client mentions a mild headache after the first dose. Which statement by the nurse are appropriate to include in the client's medication education? Select all that, apply. Okay. A client with a seasonal allergy rhinitis is prescribed loratadine. So, loratadine is the antihistamine group of the medication that we use for the patient who have allergic rhinitis, inflammation of the nasal mucosa. We do use that medication. Now, basically, they are asking you about the interventions, for the loratadine when patient is on those medication. Okay. So, the first thing, take loratadine once daily at about the same time each day. Correct. Okay. So, this antihistamine should be used during the daytime. Okay, loratadine once daily at about the same time each day. Sorry, same time each day. Patient needs to take that medication. Now, second, you may take this medication with or without food. Yes, there are no restriction, no specific education that you have to give to the patient. This medication can be taken with or without food. No problem. Take an additional dose every 4 to 6 hours if your allergy symptoms return. No, that is not right. Only once daily you can take this medication. You cannot repeat the medication dose during the day. Okay, so this is wrong. Fourth, a mild headache can occur, increase your fluid, and you may take acetaminophen if it persists. Yes, so common side effect from this medication is mild headache. Okay, so that is common, and so for that no specific interventions are needed. You can just advise the patient to take Tylenol. Okay, you can advise the patient to take acetaminophen if the headache is persisting. Okay, so this one is correct. This medication is unlikely to make you drowsy compared to older allergy medication. So this is also correct because this medication is non-sedative. This is the, I would say, first generation antihistamine. First generation antihistamine are drowsy. Okay, like it causes drowsiness. But the second generation antihistamine medication, they are non-drowsy. And loratadine is a second generation antihistamine that can be used during the daytime. It is not going to give you any dizziness or drowsiness. So what patient is saying, this medication is unlikely to make you drowsy. The nurse is saying that this medication is unlikely to make you drowsy compared to older allergy medication. So that means the first generation, they are older, they can give you drowsiness, sedation, but the second generation you can take during the daytime. Okay, stop the medication immediately and avoid it in the future because a headache is a serious reaction. No, headache is not a serious reaction. So let's look at some information about the second generation antihistamine. Examples कौन कौन से है तो loratadine, that is claritine is a brand name, cetirizine, Zyrtec is a brand name, fexofenadine, Elagram, desloratadine used for seasonal allergies and allergic rhinitis and urticaria. Dosing once daily because this medication is long acting, so once a day only. You cannot redose, no need of taking this medication again during the day. It can be used with or without food. Okay, it is not going to affect any absorption. Very less chance of having any sedation because second generation are more advanced, non-drowsy. So it can also be used during the daytime. First versus second generation. So first generation, that is diphenhydramine, that is Benadryl, hydroxyzine. This medication can cause sedation. So this medication can be used only at night time. Okay, this medication has anticholinergic side effects. So dry mouth, urinary retention, constipation, blurred vision, all these side effects can occur from second generation antihistamine. Common minor side effects from first generation antihistamine is headache, dry mouth, and mild fatigue. Okay, so there is no need to stop that because these side effects are very mild, expected. There is no reason to stop the medication. Teach the client to avoid any alcohol and other CNS depressant and to report a true allergic reaction like rash, swelling, difficulty breathing. If this occurs, then you have to notify to doctor and tell to the patient not to use any alcohol or any other CNS depressant with this medication. Clear? Okay.